Okay, good morning everyone. Welcome to this public meeting of the Humber North Yorkshire Integrated Care Board. Welcome to everybody who's joined us for our live stream. I wanted to start by saying I know that we've had a few issues with the live stream of our most recent meeting. So hopefully we have sorted the technology, although that wasn't particularly a good start, but hopefully it will improve as we go along. But just to let people know that from our next public meeting, which will be September, we will be offering members of the public the opportunity to join us in the room to attend those meetings in person, and we'll clarify to people the arrangements that we need to put in place. But that will be from September. So in terms of just introductions, I'm conscious. 2 meetings ago, I think when I assumed this chair role, I talked about making some changes to the way we did business, to the way that we structured agendas, to the way that we connected board committees to this board, but also kind of recognising that there was an opportunity to refresh our membership. I think in particular, reinforcing the role of local government around this table. So I'm really pleased to kind of welcome Alison Barker on behalf of the Chief Executive, Local Authority Chief Executives, Tracy Meyerhoff on behalf of Adult Social Care across all 6 places. We do have a place for a Children's Services representative, but we have unhelpfully clashed with some Director of Children's Services conference this week. So we do not have a Director of Children's Services representative around the table. So just to kind of welcome you to this board. As we go through, I'd say if you are presenting, new members always provide a challenge because they haven't been part of history, which is always quite useful, I think, sometimes in kind of asking some of the more obvious questions. But we might just want to take some time to kind of bring you up to speed on where we're at. But I'm really grateful for your kind of participation around this table. What you will see from the agenda is the real mix now of, I think, the work we are doing as an integrated care board. So the focus on today's business, as well as some of that planning for the future around transition. And since we last met in this room, we've had the release of the 10-year plan and the penny dash review into quality arrangements, and we'll pick up on those. So we are hopefully slightly clearer than we were around direction to travel, but we will have some time on the agenda to kind of talk about those things. You will also see that in terms of the papers, we've ordered the agenda differently, so hopefully that kind of gives us some flow. And we will kind of just move through this business. And I think just to remember, there is an opportunity, I think, to go back to some of the issues that we raised in part 2 of the meeting later on. So just in terms of just introductions, I'm conscious of the new faces. If we just go around the table, introduce ourselves, whilst it'd be really nice to know your career history, you probably don't have the time. So let's keep that really focused. I'm going to start at the bottom of the table with Abby.
Thank you, Chair. So I'm Abby Coombs. I'm the Deputy Director for Legal, Governance and Regulatory Functions in the ICB, and I'm here today just to tag team really with Jane in terms of the governance reports in the absence of the Exec Director of Corporate Affairs.
Lovely to see you, Abby.
Good morning, everybody. I'm Tracy Meyerhoff, Director of Adult Social Care for Hull City Council and also the Regional Branch Chair for the 15 local authorities.
Tracy.
Hi, I'm Louise Wallace, Director of Public Health, but here on behalf of the Public Health Directors for the Humber and Yorkshire region, no, Humber and North Yorkshire region, but I am chair like you with the 15 others, but that's not what I'm here for. That makes sense. Are you really? I'm not really. Most people ask that question for many years, Tracy.
I can tell this is Spartacus by the time we get round to Dunbar. Squatting your Dunbar.
Michelle Ryan, Chief Executive of Humber Teaching F2, but here on behalf of the Mental Health and Disability, Neurodiversity and Autism Collaborative.
Thank you.
I'm going to introduce me, but Alison Barker, Chief Executive for North Lincolnshire Council and the North Yorkshire and Humber Chief Execs.
Sean Jones, Director of Planning Performance and Acting Chief Operating Officer.
Hi, Annie Halsterbrook, Executive Director for Communications. And Chair, apologies, may I just interrupt for 1 second because I don't think the video feed is working, Emma, on the live stream. The sound is working, but not the video. I don't know if you can try and rectify, please.
If we just go ahead with the sound for now, then hopefully I've worn a new shirt deliberately, but thank you, Anya. Richard.
Everyone, I'm Richard Glavin. I'm a non-exec director and chair of the Finance, Performance and Delivery.
Stuart.
Morning, Stuart Watson. I'm a non-exec director and chair of the Audit Committee.
Hi everyone, I'm Des Irving Brown. I'm the Executive Director of Finance and Investment for the ICB. Morning, everybody. I'm Teresa Fennick, the Acting Chief Executive for the ICB.
Tristan Stamp, I'm the acting chair of the ICB.
Ruby Thorpe, Executive Director Strategy.
Mark Chamberlain, I'm a non-exec director and I chair the Remuneration Committee and Quality Committee.
Jane Adamson, Director of People for the ICB.
Hi, I'm Simon Sockel. I'm GP in Whitby and I'm here on behalf of the Primary Care Collaborative.
Nigel Wells, I'm a GP. I'm the Executive Director of Tindall Care.
Carrington, I'm Deputy Exec Nurse for the ICB and Director of Nursing for Health and Care Integration.
Morning, everybody. I'm Andrew Bennell. I'm the Group Chief Exec of CHCP CIC.
Bushra Ali, I'm a GP in Hull and I'm here as the primary care partner member, and that's primary care, general practice, community dentistry, community pharmacy and community optometry.
Good morning, I'm Dumbo Ngage. I'm an Associate Non-Executive Director. I'm an NHS consultant.
To see you, Dumbo. So just to remind people that this meeting is being live streamed. People apparently can't see it at the moment, but they can hear us. And the meeting is also being recorded for purposes of AI. And just to confirm, in terms of as part of the board refresh, we went and confirmed the partner participant members around the board table. So if you remember, we have 3 partner participants who carry a vote around this table. Just to confirm, the government partner kind of vote sits with Alison. The provider vote sits with Michelle Moran, and the primary care partner member role is Bushra. So just to confirm, so thank you for your help in kind of confirming those arrangements are kind of moving forward. So, and also, I'm just going to, I touched on my report a bit later, but Richard, this is your last meeting as a non-exec director and chair of our Finance, Performance and Delivery Committee. And I just kind of wanted to say thank you for coming. And also thank you for the work that you've done in your role as non-exec. And I think on my paper, I touched on the fact that, you know, we will not be replacing you, not because you're irreplaceable, but simply in light of the changes kind of moving forward. NHS England are reluctant to kind of fill NED vacancies within current structures. So that potentially causes some additional activity for myself, Mark and Stuart, but just to kind of let people know. But thank you, Richard, and good luck for whatever you do next on the South Coast. Okay, so apologies for absence. So like I said, we've got apologies from our Children's Services representative. Children's Services will be sharing that between Merlin Joseph from East Riding and Martha Kelly from York, much in the way that we're sharing the adult kind of role tracing. So there's an apology there. There's an apology from Karina Ellis, apology from Amanda Bloor, apology from Simon Morritt, and everybody else I think is present and correct. So is there an item of governance, Jane, Abby, that we need to take before we move on to the rest of the agenda?
Yeah, there is. Thank you, Chair. I wanted to raise with the board and put forward for approval the acting arrangements that we've got for the chief nurse role in the ICB, with Teresa in the acting chief executive role. We've got a job share between Michelle Carrington and Paula South currently that means that we need that vote as part of our board generally. So we just wanted formal approval from the board to that. I don't know if Abby, you want to add anything else, but I think that's close.
I think the only thing to note is that would bring the board arrangements in line with the operational scheme arrangements as well. So we won't have that slight split, which is quite confusing from a governance perspective. So it just sort of formalises the arrangements and aligns the two.
Proposal there that we formalise the arrangements. Are people happy with that? Okay, super. Thank you. Of course, we didn't check with you, Michelle, that you were happy with that, but
I'm really happy with
we decided on your behalf. So thank you for that. Register of Members, you'll notice in terms of the papers that slightly different this time, that at the front of the papers, there is a list of all the declared interests of board members. In the interest of transparency, I think that is really important. Just a reminder that if your interests do change, you need to let us know as soon as possible, and we can kind of update those. And it's just for us to note it as we kind of go through the meeting. And in terms of declaration of interest for this part 1 of the meeting, the main declaration of interest relates to the transition committee, and that relates to all of the executive team, the acting chair and the non-exec directors, and anybody else who's employed by the ICB. We will remain in the room for those items, otherwise there's nothing to talk about. But actually, we're just kind of noting those interests there. Is there any other interest that people have just suddenly thought about that they need to declare? If one does arise, please put your hand up and we'll work out how we manage that in the room. Quite a lot of papers and bits to get through. I'm going to work on the assumption that you've all read them. There was a late paper that came out yesterday evening, which some of you won't have picked up from this morning, but I think there'll be a presentation. That's part 2 paper. And if you are presenting today, really, work on the assumption you've read the paper, tell us the key points we need to do, and be clear with us about what you want the board to do in terms of the actions that you are presenting. Okay, so we're going to the minutes of the previous meeting, which is the 19th of June, which you've all got in your pack. We'll go through for corrections and accuracy, and there is no action list relating to that meeting you have on the 19th of June. So pages 1, 2, and 3, 4 and 5, 6 and 7, page 8. Are people happy for you to sign those as a true and accurate record of the last meeting? Super. I shall do that. No matters arising from the last meeting. There's been no notification of any other business, so there is no any other business. And we've had no questions from members of the public either to respond to in this meeting. So we're going to move on to board assurance framework. Who is leading on this one? Is it you, Jane?
I'll introduce and then Abby will take you through the detail in the paper. So you've got in front of you the paper that I think you will have read around the update of the board assurance framework, which is built on the conversations we had at the last board. There's a number of things that Abby will take us through. So there's a number of risks to add in and there's a number of risks to close out. So if I can hand to you, Abby, to take us through that.
Thank you, Jane. Okay, so the board assurance framework, as Jane's already described, has been realigned to the new statutory objectives. It's taken a bit of jiggery-pokery in the background from the governance team to try and do that. But what's set out on the paper is that 3.1 is the new risks recommended for approval. There's a new risk in A2, which is a failure to operate within the ICB's available resource. There's then a linked one to that in A3. The wording is pretty much the same. And then there's another one at A4, which again is about operating within our financial resources. So they're the new risks that we're asking the board to add on to the risk register. There's also then one for the transition committee to be added on. And then at 3.2 is the risks recommended for closure. I think primarily they're associated with last year. That's why they're recommended for closure rather than them being this year's risks. So one again is about the operational plan for last year and acting within resources. And then there's one about failure of recruitment and retention of staff, which of course is consumed into the transition risks.
Okay, so if we just to begin with, I suppose, approve the removal of the risks that are coming off, and I think they largely are there. So I think things that relate to last year. So we've recast it with a different financial year, but it's almost the same. But we're just tidying up.
Yes, it's a similar risk, but updated for the new year.
Yeah. So in terms of those two finance risks, are the board happy to remove those risks in terms of the board assurance framework?
Yeah.
Okay. And then the other one that was being removed was the one, the external workforce risk, I think, Jane, that's been replaced by the risk that relates to the transition committee.
That's
so,
right. Yeah.
So are people happy with that external workforce risk coming off the board assurance framework? Okay. So the addition, so are the board happy with the addition of the new risk relating to finance? And are the board happy with the addition of the risk that relates to the work of the transition committee?
Yes.
Jeremy.
So I'm happy with the one that's here, but I'm wondering why there isn't one that talks about essentially patient impact. So we're reorganising all sorts of things. This talks about impact on our workforce, so fair enough, I've got a particular issue with that. But I was sort of expecting one that goes, we better get this right, otherwise patients will be impacted.
So an external risk relating to transition as well as the internal. I mean, that's something I think we could pick up as part of the, we certainly touched on that in remarks as transition committee.
So we talk about that in quality committee, but I think Stuart's question about whether it should be on a board level, Bath, is it?
There's a sort of ongoing quality risk.
Yeah.
So we
Yeah.
always have something on, but there's a special transition risk, would be my view.
Yeah.
Yeah,
Okay.
absolutely.
So if the board are happy, we could ask the transition committee to pick that up. Michelle?
You brought up the risk of quality. There is already a risk, as you can see at A1. And it was a bit of a test to see if you'd read the papers, I think.
So I was going to come on to
Yeah.
that one because I had a
Yeah.
question about that.
Okay, you guys.
So if we just do the transition risk
Sure.
first, based on that conversation, if we can ask the transition committee to pick up the external kind of risk around transition, Teresa?
So can I suggest that there's a step before that?
Yeah.
Because I think the quality committee need to look at it first and ask then the transition committee to review and add any mitigations from the transition committee responsibility before it's
No,
it's
that's
then agreed
sensible.
by the transition
You're
committee.
absolutely right. And the quality committee discussion we had, not the meeting reported in this agenda, but the quite recent one.
Yeah.
Did touch on that as the absolute importance of maintaining quality through a period of change.
So the action then is that we ask the quality committee to look at that and then take that into the transition committee. You're happy with that one?
Yes.
Yeah. Okay. So Michelle, take us to the quality risk. Because this was,
What we've just told.
yeah, and I think it's very interesting in the papers, that one in particular. So that's why I was going to come to it. So
It's interesting in that it's incorrect. It can't be correct.
no, and if it is, I'm very worried.
And the board shouldn't be worried about anything that's 25. And anybody that knows me know that I think you should treat 25 with great care. It's the most catastrophic risk that could ever happen. So if you ever see a 25, the board should know about it. So it's not 25, it's incorrect. And I think there's just a mistake that's been made during the conversation at quality committee and the update of this. So we're committed to take this back, make it a regular item of quality committee. And also the mitigations are a bit out of date underneath it. So we're going to tidy up all of that. And it can take into account the conversation we've just had about transition and making sure things don't fall through the cracks on the way.
So I think that external risk sits in two places, doesn't it? And I think it's not a case of it's one risk is more important than others. So in light of that, I think if it goes to the next quality committee to kind of review, and then we bring this back to the next board just to sign off, if that's okay. Alison.
I think it probably just relates because one of my points was around 25 and being balanced.
Yeah.
I don't quite understand the process, but I don't know if it's because that's wrong. So it might be helpful, not in here, but if there is somebody that maybe can just brief me in terms of the sort of appetite, out of appetite and what's balanced and not, because that was the first one I read, so I was a little bit perplexed by the process.
And having new members on the board, we might want to do a bit of work on that.
Yeah.
Yeah. Jane.
But there's probably a broader point, Alison, in terms of new members to the board and us bringing you up to date on a number of things, not just the BAF actually, so that you understand more fully.
Yeah, that'd be really helpful.
Yeah. I think it would be helpful as a board to kind of revisit that whole risk conversation as well. So people are understanding the out of appetite, the balanced and the relation between the BAF and the risk register as well. And you'll see later on, we're asking committees to be much clearer about the risks they are managing. Abby, are you volunteering to do that for us?
We'll do that. I think there's probably something though about the new board reviewing its own risk appetite because it will be different from the last board because you're all different.
Yes, and I think that's true. And I know last time we spent a lot of time kind of looking at risk appetites around the board table, and there were.
I'll try and make it interesting.
It was very interesting.
That's interesting. No,
Yeah.
it's good.
Yeah, some of us around this table were very high risk.
Yes.
Yes, exactly, which is why we have a board to balance everything. So, any other questions around the board assurance framework? Richard.
Just an observation, really. It probably relates to a later bit on the agenda. I think when we're talking about revamping the style of reporting from the subcommittees to the board, I think part of it is that risks above a certain threshold would be explicitly be reported upon in terms of what the committee thought about that risk. Now, I think the current idea was that it'd be anything that was marked 25. That feels like quite a high bar to me. And just having looked at all of these in the summary table, it suggests to me that anything that's 20 or above, there needs to be a specific comment from the subcommittee around that risk.
Yeah.
So I think when we get on to looking at those reports from the subcommittees, it's probably worth bearing that in mind.
I think it's a really, I think it's a really good point. because actually part of this is about the board's assurance that the committee is managing the risk. And actually, when you get to 25, that feels as though the risk is out of control. Okay, so anything else in the board assurance framework? Okay, so we've taken risks off, we've added risks in. We're going to take another look through the Quality Committee and Transition Committee external risk. And Michelle is offering the Quality Committee to review that quality risk and to come back to the next meeting with revised risk with more up-to-date mitigations. Okay, thank you for that. So my favourite item every year is the committee terms of reference. Which I'm assuming that you've all read. So this is huge, and it's a snapshot. It's not all of them. There's more yet to come.
There's more to come. Yeah, there's a number that are outstanding, but you've got the ones in front of you for the Audit Committee, Quality Committee,